Hi, my name is George Castillo, and I've been dealing with MS for 30 years, since '84. Anyway, as we all know, this year Tecfidera was released, and I decided I was going to try it. So, since this year, 2013, I've been on Ampira and Tecfidera for about the same period. It was about March. And I'm just going to give you guys an update. Anyway, I've been doing pretty good with it. I saw my neurologist a few days ago, and he asked me how I was doing. First of all, he asked me about the side effects, and initially, the first time I tried Tecfidera, I felt the flush that they talk about. One time, my whole face felt hot, and after that, or concurrently with it, I also experienced a little bit of soft stools, not really formed. Lasted about a week or so, not too long, wasn't very bad. So side effects with Tecfidera have been pretty well non-existent for me. No problems with any side effects. Been feeling pretty good. Doctor has been keeping blood work, checks on me. Blood levels are fine. Tolerating the medication well. And so my doctor, he was really excited. He's at a university here close to San Francisco. He's really excited. Expects really good things from this medication. Asked me how I felt about it. I said, well, I was on Copaxone for 14 years. Shots don't bother me, and taking it orally is a lot easier. So he says I felt that he was really positive in the fact that he felt that the efficacy, the effects, the decreased lesion load compared to other medications, if the medication was well tolerated without any side effects, that he really thinks this is going to be a good thing. But in his mind, he's all about safety first, so he's making sure that my blood work's fine. I've had 2 MRIs, going to have an MRI again this month. But the MRIs have shown that my condition has been stable. Other input that I've had is on my general practitioner. I saw her this week, and I asked her what she felt about my MS, and she says you've been stable, and she feels really good with it. About a month ago, I saw my neurologist, who was the first one who sent me to the specialist in San Francisco, and she said it's really difficult with you MS patients because some days you're feeling good and some days you're not. But she says you look good, whatever you're doing, keep doing it. So I felt pretty good about that. My wife, she's probably right there. She's a registered nurse, and she was telling the doctor, that she felt that I was doing good. She felt that the medication, that I was happier, and that I had higher levels of energy, and that always made me happy to think that I was doing good. I do pretty good. I keep a real positive attitude, and I know I do have a lot of high levels of energy. I'm not so tired anymore, so much. I feel, well, right now it's kind of cold, right? I mean, it's really freezing for some people. And I was up in Yosemite the other day. It was pretty cold over there. Anyway, so I'm all green lights on Tecfidera now. No problem. I'm happy with it. A couple things that I'd like to mention. I asked the doctor how they came about finding out that this medication, Tecfidera, helps people with MS, and he explained to me that in Germany there was a pharmacologist who had psoriasis, and he figured out, he synthesized something. He had an idea to help him with his psoriasis, and then apparently they started to prescribe this medication for people. And he mentioned that people with psoriasis have MS, and some people with MS have psoriasis, and since it's an autoimmune condition, they one day one doctor was seeing a couple patients in his practice, and the patient with them, he asked his patient, "How's your psoriasis doing?" And the patient who also had MS said, "My psoriasis is better, and so is my MS." So he said, on the basis of that couple clinical testimonies, they decided to try it, and so here we are. We're trying it on MS, and it was kind of exciting to hear that. Another thing I would like to mention is, the other day I went to a seminar on MS, and the neurologist was talking about Tecfidera. I think this is really important because a lot of people, they have MS, it's relapsing, remitting. It comes and it goes. So when the remission, you think, oh, it's gone away. A lot of us, we're so much about wishful thinking. No problem with that. I'm all about hope and wishful thinking. But the doctor explained that MS is an autoimmune condition. Of course, most of us know that, but it is also can be considered an inflammatory condition. So we kind of know that, but so when we're not in this inflammatory process, our symptoms are diminished, or for some of them almost non-existent. So easily tolerated. We can function well, especially in the early stage. But she felt it's really important to be on some kind of medication, because she gave the tip of the iceberg theory, and the underlying part of that iceberg is there's a lot of science that still doesn't understand what's going on in MS, and it's important to be on some kind of therapy, especially for newbies. I used to be a newbie. I wish Tecfidera was around then. Anyway, I kind of relate to that because, I'm pretty positive. I don't know what individuals out there watching this perceive of me, but I can relate, I've had pain where can't move, can't breathe, don't touch me. My left foot, I say it's dead because it hits the floor, thump. I remember the day that I wish the doctor would have started me on steroids, but he didn't, and I wasn't really proactive because that foot really is dead, in my opinion. It's still kind of, not really. It's pretty non-functional. I drag it around. I learned how to do that. Anyway, I'm ready to go. This is my last testimony for a long time. I share my story because I know I was out there looking for people that were starting Tecfidera, wondering, is this going to be okay? Well, for me, Jorge Castillo, 56-year-old Hispanic male with MS for 30 years, it's going to be my medication of choice. One thing, cost. No insurance, no medicine, no feeling better. I'm laughing, I'm smiling, but that's the unfortunate truth. But, the company that supplies Tecfidera, they have a program, and if a person doesn't have Medicare, they can qualify. It's like a $10 copayment. Our insurance, too, this is another important point. Our insurance is changing so that if the medication is preventative of the condition, then they'll pay 100%. Well, we know that there's no medicine out there that's going to prevent MS in theory. But anyhow, I mentioned that to my doctor, because apparently, we can fight it, we can appeal. And I asked the doctor, would you write me a letter saying that this medication would prevent? He says, of course I would. I really believe that, and I'll write that letter for you. So maybe that your insurance will see that it will prevent further progression of the condition, and that's good news for me. But also the company, the Tecfidera company, they'll also have financial support as other companies. So if you're having financial difficulties out there, go out there, network, branch out, talk to people, be proactive, be positive, and let me say, do yoga, because yoga keeps me active. It really has helped, because even without MS, we're getting older and our bones and our muscles are getting weaker, so we have to be active. So, salute to you. Thanks for taking the time to watch this. I hope it helps you. I wish you all well. One time a doctor, one more story. Yeah, it cracks me up. I was losing my hearing, right? I couldn't hear. And this doctor, I went to the emergency room, this doctor says, what? Why did you come to the emergency room for that? Because it turned out to be a wax in my ear. I thought I was losing my hair. It was wax. I'd been swimming and loosened up. Why did you come to the emergency room for that? I said, I'm sorry to bother you. I'm not dying, but I have MS. I thought I was losing my hearing. So anyhow, we talked. Everything was cool. I was leaving, and he said, good luck to you. MS cracks me up because I'm still kind of get kind of upset about it. I said, good luck to me. No, good luck to you, bud, because I used to be very active just like you. So So I never wish anybody good luck. I wish you all wellness and take care. Have a great life. I am.